Council has committed to resource contributions, and if there is a system readiness, the leadership is ready to implement, and they are ready to commit. After that, we go to the third stage, but in between the third stage, we have a contract that we enter between the platform and the council. And in this contract is that the council will commit some fund to support this implementation. And then from this program design, we come up with fixed amount award, which is a contract that will be funding some activities as a catalyst fund, which will stimulate the system to work better. And after those contracts, we enter into third stage, which is implementation, where there is a huge implementation of high impact intervention, which has been proven to lead into the impact. And this goes about 3 years. And after that, we start the pre-graduation sessions when across our implementation, actually from the beginning, we implement with the concept of begin with end in mind. So from the beginning, we know that at one point we will end. So at the end of stage 4, where the council graduates and start to work on its own, we do an assessment across all these stages, and we have set a mark. For example, there is an assessment we call it rise assessment to see if we are attaining the cell coefficient, and we have set a bar at 85%. When a council reach 85% score, then when we say this council is reaching maturity and is ready to graduate. When the council is graduate, the challenge fund will stop. What remaining is the TA, where comes on demand. So when the councils need something, they can reach us to us and we can provide that TA. So during our implementation, we have these interlocking techniques. And our belief is that if one of these fours is missing in this interlocking tenet, the rest will not work. So the first one is scaling up. Our aim is to make sure that more geographical councils are implementing these high impact interventions and make sure that we empower other geographies that are not part of our support to implement the approach. And the other tenet is efficiency, where we make sure that we implement with low costs but high impact. And the other one is sustainability. And in the sustainability, we ensure that all the high impact interventions are included in the geography planning to ensure that there is a continuity. And the last one is impact. So wherever there is high impact implementation are in the plan, it's leading into the impact. So if one tenant is missing out of this, the rest will not work out. This is just an example, and I will mention about the TCI University. We are working with the association and different bodies to ensure that there is proven tools to work in our settings. And one of the example is Tanzania Nursing and Midwifery Councils, where we team up together with them, and they are using some of the tools from the TCI University. This TCI University is an online university which is keep on updating every year and day. So we have like 5 toolkits within the TCI University, which has been accepted by the TNMC, and the member of the TNMC can go log in, do those courses, receive a certificate, and they can claim the CPD point during their accreditation. So this is live. If you go to the TNMC website, one of the links you find there is the TCI University, and these 4 in the last bullet, the 4 courses that you find there. If you complete them, you'll get a certificate, and you can be able to claim your CPD points. And just a few points that I wanted you to take as a takeaway is that our platform is a high-performing platform that can deliver into a result. And secondly, is that TCI can accommodate other health sectors and investors to ensure that there is a continuity and sustainability of implementation of high-impact intervention. And third is that concept to begin with end in mind. So our implementation from the beginning, we ensure that the geography knows that there will be a point where the challenge fund will stop and they have to continue with their implementation. And the last one is that our implementation put the local government at the driver's seat. So from this point, I would like to welcome our panelists to take the seat. And I'll hand over this mic to our moderator to continue with the next two sessions.
Thank you. Let's give him a big round of applause, Mr. Hassan Shaula. Yes, the challenge initiative. Are we facing the challenge right now? This is the solution, huh? Okay, so we are the challenge initiative, as the model being explained well. So I would like to call upon our first speaker, Kalunde Red. Kalunde helps not a health system, but Kalunde Red is a health system specialist with a degree from the Open University of Tanzania, from Zumbe University. Currently, she does City Health Secretary at Mbeya City. She is fronting data-driven planning and monitoring of health plans. Previously, she served as a municipal health secretary in Kapora. Let's give him a big round of applause as she approaches the stage. Our next speaker is Laura Chua. Laura is a public health specialist with a degree in nursing and extensive research experience, currently serving as a reproductive and child health coordinator of Arusha City Council. She focuses on scaling up family planning and youth-friendly services. She previously worked as a zonal health nutrition coordinator for World Vision. Laura Chua, please welcome and go. The third one is Andrew Medford. Dr. Andrew Medford is a public health specialist with a degree from the University and University. Currently, the regional medical officer of Manyara. He has researched adult and sexual reproductive health, focusing on menstrual hygiene management. His experience includes roles with the medical officer for Dodoma and district medical officer for SIA. Welcome, Dr. Andrew Medford. Our last speaker is Solomon Ali Manyata. Dr. Salum Ali Manyata is a medical doctor specializing in public health. Currently serves as Assistant Director for One Health at the Prime Minister's Office, with over 20 years experience in regional and local government roles. He previously worked as a regional and district medical officer. Now he leads multi-sectoral collaboration on the health and non-communicable disease, and he drives the implementation of the national action for health security. Welcome, Dr. Salim Manbot. And myself, yeah. So, we're going to have some few questions to begin with. And the model which was explained by Hassan Shaula, we will have some group session whereby So I will start with Dr. Salim Mayaka. Dr. Salim, how has the challenge initiative TCI model shifted to your traditional approach to family planning program implementation, especially in the context of sustainable financing and service provision? Mike, please, to Dr. Salim.
Introduced the One Health, the TCI initiative approach it's an approach for family planning and reproductive child health for it's a business unusual. And their region was privileged to start in 2022. And before that, as you know, family planning sexual reproductive health was not in the THP, in the job. Family planning services were not the priority they are not budgeted in the councils. There was no innovations. The stigma during the provision of services, especially for the youth, when the youth were approaching our health facilities, there was stigma that they could not freely attend for the family planning services. So after the TCI or the Child Initiative, there was a massive change in the implementation of the family planning services. First and foremost, the approach came up with a sustainability plan in the beginning, during the planning phase. So the team of the TCI, when they approached the council and the region, the sustainability planning started from the planning phase. So they do not come with the planned activities, they don't come with their program, so they come with the initiative and discuss the challenge regarding the family planning issues in the region. And they started with their city council, and we saw the involvement of the councillors, especially the involvement of the city mayor, and the commitment from the TCI for the funding, and the council committed funding for the family planning services and adolescents and young sexual reproductive health in their council. So we saw the commitment also of the budget, the budgeting in the CCTV, in the job of the health facilities, but the foremost and important thing is the whole site orientation. That means that when the whole of the health facilities, starting from the gate, starting from all the departments in the health facilities, were knowledgeable in regard to family planning. So when they find a youth, they find a adolescent young girl approaching, attending for family planning services, the stigma really declined. But the whole site approach, the whole site orientation, beginning indicated that the integration of the farming planning services within the facility were really applicable. Talk about the CTC, talk about the OPD and all other sites in the HES facility. But the TCI came up with an innovation for the cost-effective use of the funds. So the follow-up of the funding, the follow-up of the set-side activities together with the CHMT and the RHMT was massive, and that innovation improved even the other interventions within the country. But also with regard to the TCI, the university, which is a free online learning tool from medical doctors, for nurses, for clinicians, and there's a speedy on that. When you log in and then you start learning, you automatically get a certificate. And then it's not only a certificate, but the updated skills and knowledge with regard to family planning issues, with regard to adolescent and young and youth sexual reproductive health services, to improve the skills and knowledge within the health facilities. That's improved a lot of services in our health facilities, and we saw other councils also joining, like the DC when we was there. So TCI changed a lot from traditional ways of doing things in our health facilities, in our councils, to make sure that we go to business and usual approach, and the government is driving seat for health facilities, for family planning issues, which is the key in our council. Thank you.
Thank you so much, Dr. Salum. And we have seen how business unusual model just shifted their traditional way of doing things. Now let me pose my second question to Ms. Laura Chua. Laura, let's see the impact of TCI on health system and family planning service. What tangible improvement have you observed in Tanzania health system as a result of TCI interventions, particularly in relation to family planning and adolescent and youth sexual reproductive health, AYSRH?
Thank you very much, and once again. So privileged to serve as the reproductive and gender coordinator for Arusha Council. TCI, we started the project as a project in 2019 up to 2021 as a project. Now TCI is a platform. So we are the TCI alumni. Later on you will see how we are the TCI alumni when we've been told me how to enter the TCI University, how to get the certificate. So I can say in Arusha, the TCI is having a lot of impact related to reproductive and gender, and also the family planning use, and also the youth and the adolescents. Starting with the impact. In 2019, the contraceptive prevalence rate for Arusha City Council, which was 27%. And now at 2023, it's about 42.5%, and now we are about 55% of the contraceptive prevalence rate of family planning. Also, we increased long-term method, including especially the PPFP, the postpartum family planning users. As we know, that is the gateway for covering the maternal death, especially for youth, and that also for women. And also, we were able to decrease the teen pregnancy of Arusha City Council from 11% to 13%. This data is from the THS 2, the source of data which I'm speaking here. So we have decreased the teen pregnancy. When you say the teen pregnancy, I mean the pregnancy from 15 to 24 years of age. And also the TCI, us to increase the data use and also the data for decision making. The TCI University is a good platform for coaching and also for mentorship and also for learning. The healthcare providers get the certificates from the TCI University, and also you're learning how to do the coaching in a business unusual model, not the traditional model of it. Also, we have increased the family planning users, as I've said. Also, we have increased the awareness of youth in reproductive and childbirth, and also we have increased the large number of community knowing what is adolescence and youth training service by using the TCI model. So the TCI is supporting the government. As we know, the government is in the readiness, but the TCI as a project or as a platform now, we are collaborating together with the government. At first, we were putting funds in the municipal, but later on, we sustained the program when we put the funds into the local government funds, and it also it was enabling the municipality and the local government to know how to plan and also how to put the activities which will give us the big impact and also give us the output. As you can see there, is the program which will give the results by, I can say, in a cheap price with a big result. Thank you very much.
Thank you, Ms. Laura. Let's give a big round of applause. You know what she meant? Lodos, high frequency. You invest 20, you get 80. So that's what she means. And the type of unusual model is called highs and hits. When we say highs and hits, it's not morphology of human being. Highs means high impact interventions. And the hits stand for high impact intervention practices. So we give you the activity. Whenever you invest to them, they give you higher, greater result. That's what she talked about. So we didn't reinvent the new wheel. Now let's go to Dr. Method. Sustainability beyond TCI. If TCI supports, we are no longer available. With your family planning program, be able to maintain the current level of service provision and financial stability. One lesson from TCI are critical to future sustainability.
Yeah, thank you very much, Moderator, for the excellent question. Basically, actually, when we talk about sustainability, it's an issue. We now implement several projects, and when it comes to sustainability, we think what will happen when the project ends. And from the experience, we have seen many projects, when they start, we see a lot of good performances, indicators goes up, but when the project ends, when there is no fund, you find that everything goes down. So when the TCA came to the Roma State Council, when I was the City Medical Officer of Health there, the first question I asked is what happens when the program ends? So actually they told me very simple that let us, the ends begins in now. Like what you are talking, it's what we are discussing about what will be the end. So it's a component which starts from the beginning. So the sustainability issue was taken into three components. For example, the first one was in the planning. When we started the planning, we involved the local government authorities. We involved also the health facilities and the health facility governing committees. Because now we know, with decentralization, the facility, they plan their activities, they set their budget with their government, with the local government in the areas, but also with the facility governing committees. So we involve the facility governing committees so that they can know what are the family planning is, what are the activities, what is very important on that. And for them, they understood and they agreed to give much priority to those activities. And that's when we started. And after doing that, we did another class meeting to the council management team, and they understood why we should give priority to the family planning. So that ensured sustainability in the planning in the future years. But then when we came to the funding, because the challenge initiative, it gave us a challenge fund. And then we are supposed to allocate resources ourselves as a council. And there are two ways to allocate those resources, either from the council own source or from the facilities collections. So since we were using facilities, how to allocate and to do project the family planning activities, they were able to set aside funds from their own collections, from the user fee, NHIF, CHF, etc. And then those funds were matched with the challenge fund to implement some of the activities. And that ensured sustainability because we observed over a period of years the allocation of funds from the lower level facilities to implement family planning activities was increasing. But again, we were not receiving the fund until we submit a commitment letter. Like as a city, as a council, how much we've committed to the family planning activities. And that amount, because sometimes you might say, okay, I've committed 80 million. And then what about the expenditure? I might commit 80 million and I spend 5 million. But again, we are looking to expenditures. How much has been spent in family planning activities? So after that, we receive the challenge fund and then we keep on implementing. So for years, we saw an increase of council commitment in funds to implement family planning activities. And you can see after graduation, most of the activity, the high impact activities, they are still implemented in the City Council, for example, because they were able to be incorporated into the program. So basically, sustainability starts with the planning, implementation, but also resource allocation. And by doing that, you can see that the success and continuation of the program is still there. But then, after graduation, there was what we call TCI University. And I encourage you all to look into this resourceful platform of TCI University. We had a session which is called Humanities U. At first I was puzzled, like, what is that? And then when we attended, we saw how we reviewed the sustainability plan, how it's going to work, how to ensure that all the planned activities are being implemented in the city. At the end of the, after 2 years, we observed in the facilities which we implemented the challenge initiative, the performance went up for almost 30% compared to the facilities which were not implementing the project. But then we discussed with the councillors and we said, look, if this facility they are implementing like this way, then we have to set aside a fund which will support. So it was like the challenge, the local challenge initiative. Like the council fund will also be distributed to the facilities which they have allocated some funds for family planning and they are doing well so that we can increase uptake of family planning in those areas. So by doing that, we saw the sustainability is very good and it's the same in all the councils which they implement the project. Thank you very much.
Give him a big round of applause. Thank you so much, Dr. Method. Dr. Method is like you have preempted Kalunde, very good, from there. Kalunde, we want to see the expenditure and resources allocation. How can we ensure that resource allocation for family planning are used efficiently and effectively? Like we said, some other time, the amount of money committed is not an expenditure. Unless we see the expenditure when we know that the council has already increased the amount of money to support family planning in AYSRH.
Thank you, moderator. Good afternoon. According to what we learned from TCI, first of all, in order to ensure that the fund allocated used efficiently and effectively in the family planning activities, first of all, during planning process, you have to involve all the relevant stakeholders, including donors, in the planning and budgeting process, so that all could be aware and all together we can identify the gaps and we can know where the donors' assistance reach, so that we as government we could complement the remaining. Then we could all together plan the needed issues for the community. And second, it's important to put this planning, this family planning interventions or activity into the annual plans or CCHP. so that it could be easier for implementation and even for monitoring. Also, it's important to conduct this quarterly financial review meeting. In this financial review meeting, we can see the impact of what implemented activities and in relation to the outcome. What we invest, financial investment, and what the outcome from the implemented activity. So it's important also to conduct this quarterly meeting. And also it's important to strengthen the financial management system, also to comply with the government financial management system. For example, the use of these invoices, voucher, and this activity reports, all of them could help tracking the implementation of the planned activity. But also it's very important to do advocacy to these political leaders. Political leaders could provide assistance in the approval of this family planning intervention, and also could even be very helpful in the expenditure, could also support the expenditure of this family planning activity. But also I think it's very important to have this kind of monitoring tool or checklist. This checklist can be included even in the government financial system that we have. For example, even in the supervision tools such as THS or in the THS, so that we can see or we can track the implementation of the family planning activities. Also the proper documentation and capacitate this family plan, capacitate this health management team and facility in charges. They have to know how to allocate this family planning resources, even how to execute the planning activity, but also to monitor and to report. All of this would be helpful in the so that to ensure family planning and adolescent reproductive issues could be implemented as we planned. Thank you.
Thank you so much, Kalunde. Another big round of applause for her. Yes, this is the first round questions, and all that we've been discussing since we got into this venue, we have them over there. So after the presentations, each one of us will have a moment to go about there, ask millions of questions, and we are ready to explain in details. So back to Dr. Salum Manyata. Let's look at the health financing strategy. What innovative financing mechanism can be introduced to ensure the sustainability of family planning programs?
First, thank you. First and foremost, we all agree that family planning is an important component for reduction of maternal mortality and outcome of the newborns. And then from that, we know it's so important that there's a high need of integrating the services within our health facilities. So the important thing is to integrate the services within our health facilities, from OPD, CTC, and all other point of care services. So that's the first thing. But you know that family planning is within the maternal and child health priority. We suggest for the special percentage for the family planning commodities, because women or young adolescents and young and youth would attend the family planning, but if there is no community, it's a bit hectic for them to continue with the services. So there's a need for setting percentage for commodities for family planning in our facilities, and that you can trace you can trace in the CP in the shop. And we all understand that we need to continue, as Dr. Mesa has clearly stated, that involvement of the councillors, which the TCI has, the model has been advocating that we need to mobilize funds also for the councils, for the councillors, and other stakeholders to see the importance of setting aside funds for the family planning. If we do that, we see the importance of how to improve the maternal outcomes, how to improve the importance of improving the newborn care with the use of the family planning in our services for the youth, both for the youth and adults. Then we are sure that we are going to improve the maternal child development. Thank you.
Thank you so much, Dr. Swallow. Another big round of applause to him. Ms. Laura Chua, TCI role in data for decision making, D4D. How has TCI contributed to strengthen the use of data for decision making in family planning, financing, and service delivery? And how has this improved the allocation of resources?
Thank you very much, Zuri. Data for decision making and how we use decision making and also resource allocation. As a council, the data for decision making, when we are making a project, as example to the collaboration with the TCI Jhpiego, we were used to do the quarterly review meetings after every 3 months. The quarterly review meetings were able to show the council what to do and also to scale up the family planning. As we know, family planning reduced maternal mortality rate by 45%. And also, as I can say, in the Arusha City Council, the maternal mortality rate has been decreased from 2003. It was 139 per 100,000 live birth, and in 2019 it was 139 per 100,000 live birth. But in 2023, the maternal mortality rates decreased up to 117 per 100,000 live birth. So it's a very good platform for data review meetings. And also the data quality analysis, the DQA. When we are planning to do the DQA, we go down to the facilities and we plan together through the TCI, TCIU, TCI University, because the platform also for coaching and mentorship. Then we go to the facilities. When we go to the facilities, it's a very good platform to do the DQA through the HMI registers, the tally sheets, the day register, and also the monthly summary forms. So we do the data quality analysis comparing to the data from the DHMS2, and also data triangulation from the DHMS2 as a government system and the TCI dashboard. So we triangulate the data and make comparisons and see how we are going and how the council is going. So they give us a very good support. And also the issue of the TCI after getting the knowledge on how to triangulate data and also to do the DQA, the data quarterly meetings, we bring the gap for unmet needs for family planning. And also the A1 and SRH sexual reproductive health services in the Arusha Council. And also in resource allocation, we use the data to allocate resource. For example, a certain facility can have a large number, for example, facility X can have a large number of delivery compared to the facility Y. So it was a very good platform for us to really allocate the human resource specifically, where to put more efforts and the healthcare provider, maybe to increase the number or to decrease the number. So the data give us the lighter on how to allocate the staffs, and also not only the staffs, but also the commodities, for example, the medical equipment and supplies. As we know that the CSP, the reproductive maternal child health is in priority area number 2. So we'll keep an eye. I'm not just saying because I'm reproductive and child health coordinator, no, but you know the child health reproductive health is in the cornerstones of the healthy issues. So we are joining up together with the TCI and do all the activities and make sure that we know the data. As we know the importance of data, it will give us the to know what to do, when to do, and how to do it, because it gives us the reality on what we are supposed to do in the ground. We do this together with the TCI and the healthcare provider. What is guiding us, the TCI University, as I said, is a platform for learning, and also it is having a coaching and mentorship skills, etc. And also, as we know, the good data give the government good decision, and also to keep indicator in progress. For example, the RMSA scorecards. As we know, the scorecards, the health basket funds scorecards, and also the maternal legal child scorecards, and those other scorecards. We have a lot of scorecards. So to keep the indicator in progress, and also to keep the scorecards in progress, and that gives us a light to know where to put more efforts, how they're going, and how they're doing. As we know, in the monitoring and evaluation issues, we have to monitor and how to plan, and you have to know when to do it, how to do it. So we thank the TCI Jhpiego, and
Another big round of applause for Laura. So last question to Dr. Andrew Method. Game-changing interventions. Among the high-impact interventions supported by TCI, which intervention have you found to be the most transformative in terms of improving family planning services and sustaining quality through effective financial strategies?
Okay, thank you very much. Game-changing interventions. The TCI is like it's the novel innovation, a platform, but a project which can change a lot once implemented. And we have, as we evidence to when it was implemented at the domestic council and other councils. But for the game-changing intervention, for me, I see like 3 areas. One, the traditional approach, we normally train few staff to provide family planning services in the facility. But for the challenge initiative, the whole site was trained. So it means if it's a dispensary, all the staffs were trained on issues related to family planning. So whenever clients come to receive the services, will be educated, will receive information regarding family planning from anyone in the facility. So it shows commitment in the facility, and it was able to provide services in the holistic approach to the clients. But again, there was an activity intervention which was high impact. It's called Enrich program. The Enrich activity, it used to be a very big high yielding compared to the outreach. Because we involve community health workers, we involve local government officials at the street level. They mobilize, they talk to the community, and then we plan a day for the Enrich. And when we plan a day for the Enrich, you see a lot of people that usually come for the Enrich. And Enrich actually, we were able to yield almost 3 times comparing to the outreach. So I think that also was a very high impact intervention when we were conducting the Enriches. But again, for the council, I observed one activity because usually there was a call. They usually told us that as the city medical officer first, what do you do with the universities? It was a very big problem. And they were saying, we have many programs which we conduct at universities in Dodoma. Everybody will start to explain to you what is happening to universities, what is happening in the streets, in the clubs, and at night in Dodoma City Council. And that was a question in our mind. And there was a day I received a call, and we were told like there is a lady who just threw a baby, a premature, it was like in the sewage system. And when we go to that university and talk to that lady, we found out something was missing, not on her side, either on us or in the community, because she never received information regarding the sexual productive health, etc. And when she came to university during the freshers, she didn't receive any information. And you know what she was telling us? She told us, like, Doctor, look, it was my first time, and that's when I got pregnant. And that's a university student, and that's in urban. So those are the challenges in urban and university. And the TCI, because it was very flexible during the community dialogue, we raised that concern, and we started conducting dialogues at university. And during the freshers, when they came, during the orientation week, we were given a platform to talk to the university students. And we saw attendance, we saw some changes, and I know the challenges are still there, but the TCI are providing a platform to start addressing those issues. And we saw a very big impact by conducting those kinds of activities. So I think those areas, like if we take the site as a whole, but also if we conduct more enriches, coupled with outreaches, but also if we concentrate on where are the urban challenges and where are you in urban and where you can find them, it will have a very big impact. Even the borders, you have to think, how are you going to get them? Because if you conduct your sessions during the working hours, you never find them, because they'll tell you that we are going just to collect money, etc. during the day. So it's very technical, but then the Challenge Initiative provided us with skills and approaches which we were able to reach all those kind of groups, and we were able to see them, like the success and indicators improving in the city. But most of those activities were incorporated in the CHP for sustainability. Thank you.
Thank you so much, Dr. Medford. Another big round of applause to him. Yes, Kalunde, this is our last question. Then we'll take 3 questions. Then we'll walk you through our poster that we can explain in more details. Yes, you're welcome, Kalunde. Kalunde, we want to see the adoption and adoption of high-impact interventions. How has TCI facilitated the integration of high-impact intervention into national and subnational work plan, such as the Comprehensive Cancer Health Plan, CHP? What role has health financing played in the institutionalization?
Thank you, Azeri. First of all, TCI, when TCI come after the expression of interest has been approved, TCI went very close with this CHMTs, the country management team, and TCI released fund for implementation of the family planning and the advanced central productive interventions. So, in the agreement, normally when TCI come, the local government commit fund, and it has to increase the amount of fund each year at least by 10%, and it has to utilize at least 80% of the fund committed. And so that facilitates the incorporation of the family planning activities or intervention with the CHP. And also, while implementing high impact intervention from the coaching from the TCI, and while implementing that, we have observed the quick impact, a desired result. Council made decision to put this intervention into the CHP, and also you can see the changes in performance. For example, indicators for family plan, improvement of indicator made the council or the LJ to put this intervention into the CHP. But also knowing our role, from the quick results we obtained from practicing this high impact intervention, for example, community dialogue. When doing community dialogue, we go to the university, even to the community, as Dr. said there. We talk with this border, we talk with this college students. Then from that, we have seen there is much reduction of death. Maternal death has been reduced. For example, this death from unsafe abortion has been reduced. So from there, we have no option. We have seen this quick result, and thus we have to adapt to this kind of approach and put them into the CCHP. And also, this high impact intervention, while practicing and moving from the usual system that we were doing and practicing this unusual business, we have seen a lot of improvement in different areas. And learning from the TCI University as a platform there, we'll take a lot of knowledge from there, and the knowledge we get and the approaches we have seen from different areas from that platform, we have to adapt it and to include them in the CCHP. And that we will have no option. We included those approaches into the CCHP, and now we as their city, we have seen there's a lot of changes and improving in the family planning acting. Thank you.
Wow, that was intense. So let's pasha for ourselves first. Pasha for ourselves. Moja, aside. So for them, we're going to give them the SGR pasha. Okay? So you do as I do. Okay? So you clap. Okay? Look at my hands. Okay, start to clap. Thank you so much. Okay, 3 questions, then we go to our group discussion. Yes, to Dr. Monanji over there and another 2 gentlemen. Yes, let's start with Dr. Monanji.
Thank you very much for all the presenter and moderators. Today I'm very happy to be at the TCI because I remember the first time after launching in the race now, and then I wish I still were the second one. That was 2018. Well done, you've done very well. But all of you spoke about the positive. We would like really to know, are there any challenges that you have been encountering? Because we know, like, when you are talking about the youth, they have got so many needs. And we need to focus not only family planning, but what we need to hear from you. The lesson learned, that what have you learned from the family planning intervention? How did it spread to other interventions? That would be here, because now you're talking family planning. So we would like to hear from you, apart from family planning, what else? What other indicators? What about addressing even the social determinants that are affecting the youth, including mental health, that issue for the youth? How did you address those things after getting acquainted with TCI?
Thank you so much, Dr. Monanji. Okay, please try to pass the mic around. Okay, there was our okay.
Thank you very much, and congratulations to the panelists. Just one question. Is there a need of doing post-graduation evaluation, at least to see how the LJ are faring, they're keeping the same pace or there's any drop, so that also can learn post-intervention?
Thank you.
Yes, thank you very much, and congratulations for a very nice presentation. There was Awadi Marando from USAID Mama na Mtoto, and last year we did a CCHP analysis, and one of the gaps that we've been noticing is that there is a difference between the funds that have been targeting against the disbursement and expenditure. And they've been mentioning that the councils are now starting to budgeting for this kind of intervention for sustainability. So maybe taking a reference from the Arusha CC, from my sister Laura, maybe can you share with us experience from the last financial year? How much did you allocate from planning activities? How much did you disbursed? And how much has been actually the expenditure from the money that you've been receiving? But the second question is that, what are the key interventions that you are actually allocating budget in the CCHP as far as the family planning is concerned for sustainability?
Thank you. Last question. Yes.
Thank you. Thank you for the good statistics given by one of the presenters. Good family planning reduces maternal mortality by almost 45%. My name is Agathon Mario, recent medical doctor from CSMC. So we know that Catholic-based institutions do not permit the use of artificial family planning methods. I'm not saying that in a bad way because I'm also Catholic, but how far has the role of public and private partnership tried to work with the religious institutions so as to extend the use of family planning program, so as to ensure that we have a majority of our community members use family planning methods so as to ensure good maternal care.
Taken. Mary Rose, that would be our last question. Then all your questions will be addressed during our group discussion. The figures are there, the allocation are there, TCI University is there. Yeah. You're welcome, Mary Rose.
Thank you very much, moderator. Again, I want to echo all the other speakers. Big congratulations on the panelists. I think TCI model is one of the models we really, especially when sustainability is concerned. It has already demonstrated the mere fact that we can introduce the programs and we can sustain by using them. But my question goes to the National Medical Officer from Manyara. First of all, congratulations for climbing up to be an animal. Pasha to him. So I was just wondering how you have been able to use TCI experience to also replicate in other programs. Or it's purely family planning sustainability approach, but it's not replicated in other programs. Secondly, I just wanted to understand, are you integrating also other services apart from implementing family planning services alone? For example, breast cancer screening, cervical cancer screening, etc. Thank you very much.
Thank you so much. So I think our panelists are ready to cover all those questions. So like whoever feels to start with.
Thank you very much, moderator. I'll start with the question from Dr. Onaj. He was our RF over there. He was asking what else from family planning and what the lesson learned. Apart from family planning, with TCI Jhpiego, we integrate services. When we go for family planning, we do the adolescence and youth-friendly services, the health education, and also we do the mental health part of it. We also use as a platform for TB screening, the cervical cancer screening. Now we have the HPV DNA screening for women depending on their age. Because as we know, the cervical cancer screening has its own category. And also we do the HPV screening for 14-year girls. So we do the integration. And in the TCIU, we have learned about the integration of activities. And for the issue of sustainability, now when we are working with the TCI, we have learned about the sustainability. So we know that the TCI as a project, it was 2019, it ended up in 2023. So the governments were able to know that the project is phasing out. So we committed to put funds and the activities are going up well and the indicators are improving for the issue of sustainability, improving the activities. So we work together as a CHMT, the RHMTs, and also the facilities. We prepare the timetable, the outreach, the in-reach activities. When we say the in-reach is the activities which are conducted within the facilities. So when we're preparing the activities, we prepare together and do it inclusively on the activities mentioned above. I would like to answer the question from my brother over there. He was asking the burn rates and also the CCHP commitment budget for family planning in Arusha City Council. In the financial year of 22-23, the family planning budget is 134,000. And then the CCHP budget for 24-25 financial year, it is more than 115 million for family planning. So we are increasing the budget for family planning for sustainability, and also the burn rates for the financial year 22-23 is over 98%. The burn rate for financial year 22-25 It's not so bad, but as we can know, right now we are in September, 25 months is entered, so we are in good track. Yeah. The other question of the Catholics and the role of PPP, the public-private partnership. It's not only the Catholics, there are other, even the depends with somebody how we live on family planning. So we collaborate together. As we can know that we collaborate with the government officials, we collaborate with the public institutions, with the private institution, the government institution. The ownership of the project is within the government. So when we are doing our activities, we collaborate with the private institutions, and also we collaborate with the leaders, the influential leaders. We don't have the village, we are living in the city. The ward leaders, the district commissioner, the regional commissioner. So the TCI is in a good platform, and everybody, I can say, know about TCI and also know about family planning. So the role of PPP is we're working with the other institutions and also the public private sectors. Regarding how we manage to get for example, we have a hospital at Arusha City. It's called St. Elizabeth for hospital. It's in the town center, located nearby the Health Center and the Garinaro Health Center. So they are getting the education at St. Elizabeth Hospital. That is a Catholic hospital. Then they have been educated. They can go to the nearby facility to get service. So it's not that they are not accepted, or they are not given attention, or they are not. They are given attention, they are given education, but when they want to get the service, they transfer them to the nearby facility, and we collect that data from the nearby facility and not the other facility. But in the other facility, we get the referral form, and we make sure that referral is complete so that we don't lose that data. So that's how we are doing the family planning in the institution to religious issues. Thank you very much.
Thank you so much, Laura. Other panelists, if you have something to add on top of those questions, please.
Yeah, thank you very much. I would like to address an excellent question from Dr. Rosie. Actually, it's what we do with other programs in cities, because there are many programs for vaccination, etc. And if the model can work, and if we started to implement. And actually, what I said, we started implementing and using the model in addressing issues related to social welfare services. There is an organization which approached us, it's called Mwanamke na Uongozi, and they wanted to address those issues, and we discussed with them the modality, and we implemented the program using the Challenge Initiative model. And basically, when we did analysis, we found that we allocate less than 1% of the council finances towards social welfare services and addressing the needs of people with disabilities. So when they came, they inject some fund, but then we raised the budget in the facility, but also in the council finances. And I'm sure if we keep on using this model in other areas of intervention also, we'll find that there is a sustainability in programs which are conducted at the council level. But then it should be turned not from the donor to the council, but it should be also from the council to the facilities, because council, they collect also finances, and those money can also be championed to the facilities in their plans, depend also on what also they've allocated. And after some time we find that there is an element of great sustainability. And coming to Dr. Onan, of course, yes, there are challenges. Things are not very smooth. Like we speak, for example, nowadays young people, you don't find them on radio, you don't find them on TV. You can just go to school, you don't find them. They are there physical, but mentally they are not there. They're in the social media. So you can see there are some areas which also we need to see how best we can find them and address their issues. But then, nowadays there are influencers in the social medias. That's a platform which 2 years back we were not using them. So we really need still to think how best we can reach young people and to ease the situation. But also the planning and allocating funds, it's easy, but then spending the fund and pursuing the council to release the fund, it's something else which we really need to work hard on that. That's why the challenge initiative, if we were able to spend up to say 85%, we say yes, it's excellent. It's not easy to go to 100%, but it's a way to work there. Thank you.
Thank you so much. Another big round of applause to all the panelists. Okay, Dr. Salem, please.
Just to add a few, with regard to challenges, there was initial challenges, especially with the counselors. You know, when we do advocacy, we have to start also with few influencers, because even during the Mwalimu was seeking for independence, it did not start with all the Tanzanians, so it started with the few influencers. So within the council, as well, we know we work in the councils. Most of the meetings, the councils are being done outside the council. So we started with few councillors, the influencers, and then when you go in your meeting, then those influencers are the ones who are speaking with their fellow councillors for the buy-in of the TCI initiative. So there was a big challenge of the buy-in, but when they understand, especially with the good influencing from themselves, the councillors, then the buy-in is highly productive. Thank you.
Thank you so much. So our model is called self-select to self-reliance. It's a demand-driven and local government sitting on the driver's seat. So we are so proud to welcome you all to our poster. In a few minutes you will be done. It's where you can ask more questions and you can understand in detail. So let's give ourselves a big round of applause as we stand up towards our posters. Yes, karibuni, our panelists.